Good evening, Madam Chair, members of the board. Thank you. Tonight we're going to be talking about human services, our highlights, and this isn't just county departments, but this is agencies and organizations all throughout the county that we'll be highlighting on tonight. And it just really shows that we're stronger together in all of these partnerships, not just for this time of the pandemic, but the connections that we're making that will last long after the pandemic passes. So next slide, please. Our first is social services. Social services, they have done a really great job. They are continuing to have rollouts all of the time, and they are really keeping track of all of these updates. Just this week, we learned that SNAP benefits will move to online delivery services. So people who have SNAP benefits beginning May 29th will be able to use Amazon and Walmart to be able to deliver their groceries to their home. So this is a great benefit for those who may have mobility issues or may have to be quarantined within the home. In late March, we saw a spike of our benefit applications, and when we talk about those, that's SNAP, Medicaid, TANF, and we've seen those return to pre-pandemic levels here in the past few weeks. And the assessment and resource team, they're actively engaged in meeting the needs of the customers. They work closely with citizen information resources and our faith-based partners to make sure that people who have food insecurity, that we're able to use the food bank to be able to deliver food to their doorsteps and to be able to meet the needs of other services. And then, of course, social services also continues to do their field assessments to meet the needs of the customers. And they're still going out into the community, taking all the precautions that they have to make sure that they're providing their services as normal. Next slide. Our mental health services, they launched Calm, Connected, Caring Chesterfield. This is on their Facebook page, sites, through our social media platforms, and also their websites, of just making sure that we're giving positive messages through the community that may cause anxiety, not only financial, but missing school or COVID itself. All of these things are covered in the Calm, Connected, Caring Chesterfield. And mental health continues to provide their regular client appointments. They have not seen a peak in their call volume. It remains the same as pre-pandemic levels. But what they have noticed is the no-show or client cancellation rates, those have actually gone down. And so their telehealth, telemedicine is working really, really well. And so that's something that they're looking into possibly continuing after the pandemic because of those client cancellation rates just not happening as much anymore. Next slide, please. Our telephone reassurance program. This is our outreach program in citizen information and resources. This has been well executed. It's a daily call program to our seniors, and they extended this early into the pandemic from 4 days to 7 days a week. So we included nursing home, people who are feeling isolation because they're not allowed to have people come into the nursing homes anymore. That they are able to get that call. And we worked with the activity directors to make sure that we are calling people at the appropriate time to make sure that they're receiving these daily calls. And then we've really gone above and beyond just the call, but also partnered with juvenile detention, was able to, their annual plant program that they have, and because the plant sale was canceled, they are able to deliver a flower to not only each person in our senior reassurance program, but also the volunteers who are making these calls. And then juvenile detention is also making monthly cards that we're sending to our seniors as well. So it's just been a really warm, overwhelming response from the seniors. That there's a lot of positivity to the program. And of course, we still want people to register, and they're able to do so. And they'll be in this program past the time of the pandemic. So once they're in the program, they're in it for good. This is not something that will be ending once COVID is past. Next slide. Chesterfield remains very connected. Again, these partnerships that we have, they're able to happen because of our connectivity through our internet and through our social media services. So IST has done a fabulous job of promoting all of our Wi-Fi spots available in the county. You can go to the website and you can see which one is closest to you. We've had over 8,500 residents take advantage of this program to be able to get the Wi-Fi that they needed because they can't go into businesses or they don't have Wi-Fi in their home. So this is a great tool for them. Our social media, it's a trusted source of timely information that the county is able to provide. So Since March, the beginning of middle of March, we've had 300 posts that are COVID related, and it's reached almost 1 million people, and it's caused 78,000 engagements. And then we've doubled our follower growth. The highest performing post was when our parks were announced that they were going to open with modifications, and that cost over 3,200 engagements. So this is just a really great resource that we have for our community, that we can stay connected and making sure that we're pushing out not only timely information, but also positive messages. We have an EOC call center, continues to be staffed daily from 7 a.m. to 7 p.m. They're averaging about 5 calls a day, so and it's just general information. This peaked when courts were reopening. Residents were calling, asking questions about courts. And then also we've pivoted to virtual learning. Courses that we used to have in person are now online. Our Chesterfield 101 class that we have targeted towards teenagers, we had last week. Prior, when we had the course in person, we had about 7 to 14 kids registered in the 2 classes we had. Last week we had 55 children go through the course. So this is a really positive program that we'll continue to have in a virtual atmosphere. And then the Council of Aging and many other board members, board meetings throughout our different departments have pivoted to making sure that they're providing online lessons as well. Next slide. Our community partnerships are just stronger than ever. Our letters of love, the social media post had about 8,000 engagements with promoting our letters of love, and we've had 2 rounds of over 400 letters that we've distributed to our long-term care facilities. And these letters are just really thoughtful letters to our seniors of just making sure that they know that the community is thinking of them. We've worked closely with schools and the Chesterfield Food Bank to make sure that we have a well-connected program to make sure that food insecurities are being taken care of. Each week on Wednesdays, we meet with our faith-based partners. The For Richmond group has also had a Love Your Neighbor campaign where they want everyone in the faith-based community to adopt a neighbor to make sure that they're taken care of. So all of our outreach programs are very organic and grassroots through our community. And this weaves the community partnerships that it makes people feel connected. It's just not a knock on the door and leave something behind, that there's actually conversations that are happening at a distance or at virtual platforms, or people not knowing each other but knowing that they're being taken care of. And we've had other nonprofit organizations conduct food drives. The YMCA has had 2 food drives to benefit the food bank. So all of these really great organizations, we're all tied in together. We're working with each other to make sure that we have the most effective resources for our entire community. And schools is also continuing to provide their feeding sites. They provide nearly over 100,000 meals on a weekly basis, and that's to supplement, of course, what the food bank is doing through their 2 drives. And many other church organizations are also conducting drives. So we really emphasize this really great partnership that we have with our nonprofit organizations. And we also, with our community partnerships, we check in with our daycare providers to make sure as people are returning back to work, returning to normal, that we're having conversations to make sure all aspects of our communities are taken care of. Next slide. So with that, again, mental health, we know that that's important, so we want to post that phone number that people can call, 804-748-1227. And those appointments can be made, and any other questions for the group we'll be happy to answer.
Board members, do we have any questions? Thank you, Emily, for the presentation, and to all of the teams and all of the coordination going on right now with all of these great partners in the community.